HIV is a sexually transmitted infection. It can also spread by contact with infected blood and from equivalent injection drug use or sharing needles. It can also spread from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. Hello and very warm welcome. You're watching Dr. Live Medical Talks. I am Divya. The symptom of HIV and AIDS vary dependent on the phase of infection. Primary infection, acute HIV. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary acute HIV infection, may last for a few weeks. Possible signs and symptoms include fever, headache, muscle ache, joint pain, rash, sore throat, painful mouth sore, swollen lab glands mainly on the neck, diarrhea, weight loss, cough, night sweat. These symptoms can be so mild that you might not even notice them. However, the amount of virus in your blood stain is quite high at this time. As a result, the infection spread more easily during primary infection than during the next stage. Clinical latent infection, chronic HIV. In this stage of infection, HIV is still present in the body and in white blood cells. However, many people may not even have any symptoms or infection during this time. The stage can last for many years if you are receiving antiretroviral therapy. Some people develop more severe diseases much sooner. As the virus continues to multiply and destroy your immune cells, the cells in your body that helps to fight off germs, you may develop mild infection or chronic signs and symptoms such as fever, fatigue, swollen lymph nodules, often one of the first signs of HIV infection, diarrhea, weight loss, oral yeast infection, sign glands, and pneumonia. Processing to AIDS. Access to better antiviral treatment has dramatically decreases the death from AIDS worldwide. Even in resource-poor countries, thanks to this life-saving treatment, most people with HIV in US today don't develop AIDS. Untreated HIV typically turns into AIDS in about 8 to 10 years. When AIDS occurs, your immune system has been severely damaged. You'll be more likely to develop diseases that wouldn't usually cause illness in a person with a healthy immune system. These are called opportunistic infection or opportunistic cancer. The signs and symptoms of some of these infections may include sweats, chills, recurring fever, chronic diarrhea, swollen lymph glands, present white spot or usually lesion on the tongue or your mouth, present unexplained fatigue, weakness, weight loss, skin rash or bump. When to see a doctor? If you think you may have been infected with HIV or are at risk of contracting the virus, see a healthcare provider as soon as possible. For more medical news and information, visit drlivetv.com. Thanks for watching and stay tuned.